Welcome back. The United Auto Workers Union says it will not expand strikes this week at GM, Ford, and Stellantis, the three big car makers in Detroit. It says progress is being made in their talks.
Our strike is working, but we're not there yet. Everything we've done to this point has been with one goal in mind: to win a record contract that reflects the Big Three's record profits and the historic sacrifices our members have made to generate those profits.
General Motors agreed to include future EV battery plant workers in that agreement that governs the existing union members for GM. And the agreement also puts pressure now on Ford and Stellantis to do the same thing. It's estimated that the strike has so far cost the U.S. economy nearly $3 billion. Also, the largest healthcare strike in U.S. history is now in its third and final day. It's scheduled to end Saturday morning. Over 75,000 healthcare workers picketed in multiple U.S. states this week. They work for the healthcare giant Kaiser Permanente and said that the walkout was a last resort to protest the understaffing issues. While the strike is ending, unions representing the workers say no agreement has been reached on the long-term staffing issues, including wage increases. Unions say they are waiting for Kaiser to resume talks. The both sides met only once this past Wednesday. Edits Tianshan has more from California.
Shame on Kaiser! Shame on Kaiser!
Licensed vocational nurses, home health aides, as well as technicians. More than 75,000 unionized healthcare workers have walked out of their jobs at Kaiser Permanente, one of the prominent healthcare providers across the United States.
This state is very expensive. I love where I'm from. I love my community. I love to be a part of this community. However, the going rate of a one-bedroom is $2,200. That is ridiculous, okay? We all commute. We can't live right here in West LA.
Strikers say the proposed pay raise of 6% is just to keep up with inflation. But it's also about working conditions and the number of patients they're being asked to care for.
You know, there's a burnout that happens. You can only do that for so many days, have these crazy busy days where you're just nonstop going, you know, trying to use the restroom and get all your water in and still keep up with patients. And the other thing is that the patients don't get the care that they need, you know.
The strikes come at a time when many healthcare workers were burdened with the COVID-19 pandemic while facing the pressure of rising costs of living. And they're not alone. 2023 has been defined by union actions with major strikes staged by various sectors. School workers, teachers, nurses, hotel workers, fast food workers, port workers, auto workers, Hollywood actors, and writers are just some of the unions that called on their members to hold the picket lines to negotiate a better contract. And some of the success stories have encouraged others to follow suit. Kaiser officials are seeking to outsource healthcare personnel to fill in some of the positions for now, while they warned patients that some non-urgent procedures may be postponed. Negotiations with the union representatives have made no progress so far.
We're committed to paying fair wages, but at the same time, we know there's an affordability crisis in healthcare. We've got to balance that to make sure we're good stewards of our members' dollars.
It's unclear how long the negotiations could last, but America's largest healthcare workers' strike comes in a year filled with so many heated labor disputes, signaling high demand for change. It is Tianshan, CGTN, Los Angeles.
For more about this healthcare strike, we're joined by Kate Tulenko. She's the founder and CEO of Corvus Health. Good to see you again. And welcome back. I'm trying to figure out what the goal was of the strike, because they didn't have any discussions, I guess, planned for post-strike. The strike's only 3 days because you don't want to impact the patients. What was the goal?
The goal of the strike was to put pressure on Kaiser to start considering some of the concessions that the workers have asked for, particularly to hire more workers. 1 in 10 of the union positions are vacant. And as was mentioned in your piece, this puts incredible stress and pressure on the existing health workers and causes a decrease in quality of care for the patients.
And we see that in other industries as well, but specifically in the healthcare industry where you need to be fully staffed because you're putting a lot of stress obviously on the existing workforce. And what you don't want is mistakes because that can be very, very serious. What has management's response been to that issue?
They say that they're having trouble hiring people, but that's not really the right answer because Kaiser actually has training institutes. They could train more health workers if they choose to. Also, by rising wages, they would bring people who are currently, staying at home or in retirement back into the labor market. So Kaiser could solve this problem if they were interested in doing it. And Kaiser, like most other health systems, probably needs to redesign its healthcare team so that it's more cost effective. The outdated model of, physician and nurse needs to be expanded into, nurses, aides, medical assistants, and other type of providers, and also coordinating care and having more emphasis on primary care. The lack of emphasis on prevention and primary care is one of the reasons why U.S. healthcare is so expensive and gets such poor results.
And I don't want to paint a broad stroke among all the workers, but in other strikes that we've seen in this country, they're asking for a fairly significant raise when it comes to their wages, and there may be also benefits. What are the workers asking for aside from just to be fully staffed?
They are asking for an increase in wages. So in most industries, including healthcare, there really has been an erosion of earning power. Just to give an example, since 1960, general wages in the U.S. have increased about 20%, 30%, whereas the price of the average house has increased 120%, just making housing unaffordable. So that's really the thing. But what does make this strike different from the auto workers and the writers is they're not concerned about being put out of work by artificial intelligence. Because there's such a labor shortage in healthcare, anything that drives efficiencies and qualities is embraced, and more artificial intelligence that actually improves quality of care, improves the work experience of the health worker would be greeted positively. That's not a point of contention in healthcare.
Yeah, now, while it's not the whole industry, 75,000 workers does represent a significant portion of them. So whatever they end up getting, it is going to impact every single hospital in this country, every caregiver in this country, and every single healthcare worker out there who may not be perhaps part of this particular union, right?
Absolutely. There are 22 million people employed in healthcare in the U.S. It represents 14% of all jobs in the U.S. and is the main employer in most metropolitan centers. And I think also this strike will drive professions that haven't traditionally been unionized, such as physicians, employed physicians, to unionize. And this might be the game changer that really does force the U.S. to change its health workforce regulatory system. We have an extremely fragmented system. It's very expensive to train health workers. Health workers are the ultimate tragedy of the commons. Everyone wants to employ them. No one wants to pay to train them. You have different groups that regulate training, licensure, relicensure, and they're not coordinating. Obama actually had founded a National Health Workforce Commission as part of the Affordable Care Act, but it was never funded and never got to do its work.
No, we're well aware of the shortage of healthcare workers in this country, unfortunately. Now, if you take a look at the writers' strike, whatever they end up finally agreeing to, Netflix has already said they're raising prices. The car companies say that if we have to pay more for the workers, we're going to potentially raise our prices. And I don't think the healthcare industry is any different. If we pay our workers more, wouldn't the cost of healthcare ultimately go up for Americans?
It doesn't have to. The cost of healthcare has been outpacing inflation for decades. And I think that health systems can retool how they do their work to actually drive down costs. They also could reduce the costs at the top. The average hospital CEO makes about $30 million, which is about 400 times the average nurse at $80,000. There are a lot of affordable cost-cutting measures that can be done. The cost of increased wages for health workers does not have to be passed on to the patient.
All right, Kate, get in there, get us an agreement so we can move forward a healthier and happy life. We need these healthcare workers for sure. Thank you and have a good weekend.
Absolutely. Thank you.